Deadly AIDS epidemic risks resurging and respiraling into a crisis of epic proportions unless billions is spent on prevention, warn experts. And so this is happening all over again. And there's a warning that is put out because money is spent more on retroviral drugs rather than keeping people who aren't infected from getting HIV. So experts spoke at an event before the International AIDS Convention in Amsterdam. They raised concerns over the alarming rate of the new HIV infections globally. According to the UN, which is the United Nations, there is a funding gap, almost 4.6 billion, 6 billion. This is by Stephen Matthews for Mail Online. So the AIDS epidemic beat the deadly virus, than deadly disease, experts fearing. So leading researchers yesterday begged for billions in extra funding pumped straight into prevention and treatment of HIV. On the eve of the major world conference, they raised concerns over the alarming rate of the new HIV infection, soaring numbers of young adults in hard-hit countries. So Mark Dybul, diplomat and former executive director of the Global Fund for Fight of AIDS, warned that the world could be steering for a crisis of epic proportions. So speaking at a special event organized ahead of the International AIDS Conference in Amsterdam, he said, "Bad things will happen if we don't have more money." So the United Nations, which is the UN HIV AIDS body, UNAIDS, last week warned that the fight in controlling acquired immune deficiency syndrome was at a precarious point. According to the UNAIDS executive director, Michael Sidibe, there was a funding gap, almost 4.6 billion, 6 billion. And so more people are catching it. And there's not enough of funding for prevention. There's funding for people who have already acquired and already have HIV in terms of retroviral drugs, but that's not enough. That's not curing people of HIV that could possibly turn into AIDS. And so that's the problem. And there's not enough being done to prevent people from getting it in terms of warning people and people being more cautious about their activities. So leading researchers yesterday begged for billions in extra funding pumped straight into the prevention and treatment of HIV. And so they may even run out of treatment for people who only have HIV. And so it will get down to that eventually. So around 18,000 researchers, public health officials, and policy planners are expected to attend the International AIDS Conference in Amsterdam. So ahead of the biennial meeting, which begins today and finishes on Friday, AIDS experts spoke at a specially organized talk yesterday. So they warned to meet the UN goal of ending AIDS as a public health threat by 2030. HIV infections must be limited to 500,000 per year globally by 2020. But last year, 1.8 million new infections showed unless something completely drastic happened, officials will remain far away from this target. An estimated 36.7 million adults and children worldwide have HIV, including at least 88,800 in the UK, around 1 million in the US are infected. So the virus progressively damages the cells in the immune system, weakening the body's ability to fight off infections. Without treatment, this leads to AIDS, the collective name for the series of life-threatening infections which the weakened immune system cannot withstand. So Nduku Kilonzo of Kenya's National AIDS Control Council told the meeting, "We are far, far away from our goal of prevention, not just elimination. So we have a crisis, and it is prevention crisis." So she warned that Kenya and other countries have seen investment in condom distribution as funders focus on doling out antiretroviral drugs or antiretroviral drugs. David Barr, a senior treatment advocate who is himself HIV positive, agreed that access to drugs without prevention will not end the AIDS. So he told 92, "I could never imagine that I would be standing here 26 years later alive and well." He added, "We can lose our opportunities and the tools them, then we're back in the horrors of 1992. So in 1992 was the midst of the epidemic. AIDS became the number one cause of death for American men aged between 25 to 44 years of age. So in its update report last week, UNAIDS warned time was running out in meeting the elimination targets. It said the world is slipping off track. The promises made to society most vulnerable individuals are not being kept. There are miles to go in the journey to end the AIDS epidemic. Michael Sidibe, executive director of the body, noted that there had been great progress in reducing deaths from AIDS and dishing out antiretroviral drugs. Estimated 21.7 million of the 37 million HIV patients across the world were on treatment in 2017, 5.5 times more than a decade ago. This rapid and sustained increase helped drive 34% drop in AIDS-related deaths from 2010 to 2017, according to the UNAIDS report. AIDS deaths last year were the lowest this century, at fewer than a million. But Mr. Sidibe pointed to what he said were crisis situations in preventing the spread of AIDS, or HIV rather, and in securing sustained funding. So he said that the success in saving lives has not been matched with the equal success in reducing the HIV infections. So the new HIV infections are not falling fast enough. So HIV prevention services are not being provided on an adequate scale and are not reaching the people who need the most. Okay, so Sidibe slammed Mr. Sidibe, which was the target in 2018 this year. So the data in the report showed that the overall among adults and children worldwide, some 1.8 million people became newly infected with HIV in 2017. So since the start of the AIDS epidemic in the 1980s, more than 77 million people have become infected with HIV. Almost half of them, 35.4 million, have died of AIDS. The report said that at the end of 2017, 16.2 billion, 21.3 billion was available for the AIDS response in the low and middle income countries. So more than half of that came from domestic funding sources rather than international donors. So UNAIDS estimates 19.9, 26.2 billion will be needed to fund the AIDS fight in 2020. So that doesn't sound good. It sounds like it's gotten more out of control because people think because they can take the antiretroviral drugs that they live longer so they don't have to worry about catching or reinfecting other people, when in fact it is getting worse. Because whenever something sounds too good, it probably is. And it probably isn't going to work for too long. So Mr. Sidibe goes on to says that there is a funding crisis. And so while global AIDS resources rose in 2017, there was still a 20% shortfall between what is needed and what is available. So a shortfall will be catastrophic for the countries that rely on international assistance to fight AIDS, he added. And so that's really bad. So what people are taking is a cocktail so that they can live longer. And in Yahoo this morning, they showed a guy who said that he's taking drugs and he was living He had gotten diagnosed in 86 and he's still living. And so that encourages people to not be afraid of contracting the virus because they have this new pill called PrEP. And so HIV transmission and prevention, you can get the and transmit HIV only through specific activities, most commonly sexual behaviors and needles and syringe use. So the FDA has approved more than 24 antiretroviral drugs that treat HIV infection, and they're most broken into 6 groups because they work in different ways. So-called antiretroviral therapy, which is called, in short, abbreviated ART. It can't cure the HIV, but the medications can extend the lifespan and reduce the risk of transmission. So the nucleotide reverse transcriptase inhibitors, which are NRTIs force the virus to use faulty versions of the building blocks so infected cells can't make more HIV. And non-nucleoside reverse transcriptase inhibitors, NNRTIs bind to a specific protein so the virus, it can't make copies of itself. So protease inhibitors, which are PIs, these drugs block the protein that infects cells needed to put together new copies of the virus. Fusion inhibitors, these drugs block the HIV from getting inside healthy cells in the first place. So CCR5 antagonists, this stops HIV before it gets inside healthy cells, but in a different way than fusion inhibitors. It blocks a specific kind of hook on the outside of the certain cells so the virus can't plug in. So integrase inhibitors, these block HIV from making copies of itself by blocking the key protein, allows the virus to put its DNA into the healthy cells of DNA. And so there's a lot of pills that people end up having to take. And so, if you want to have a life of taking pills to keep yourself alive because of this, and now they're talking what looks like there may be a shortage of funding. I wouldn't be surprised at some point or another that they end up running out of money to even provide the antiretroviral pills just to keep people alive who have HIV. And so it said, unless billions are spent on prevention, it warns, the experts are warning. So there's a funding gap. And so that was according to the United Nations. So there's so many people now that are contracting it because there's no fear of it, because they know that they can live longer. That is a problem in and of itself. It's not enough being done to persuade people to live in a way where they can be cautious about their activities. It's actually a push on people feeling like, oh, okay, I don't have to worry about it because if it happens to me, I know I can take these drugs, they're available, and I can live longer. And then two, also, I did hear that in some places where people are, strapped for cash, or they're in a situation where they are on the street, that they're willing to contract these viruses so that they can receive benefits, because in some places, benefits are very plentiful when you do have this disease. And so that could be also a contributing problem. And then the lack of fear. And then, the ads that you see are the, articles you see of people who say, we live longer now. We don't have to be afraid. I'm taking all these antiretroviral drugs. And, but eventually, if the funding runs out, who are the people that are going to be most at risk? It states the most vulnerable people who really can't afford the medicines, because if you didn't have any insurance to pay for the medicine and they run out of medicine or they run out of antiretroviral drugs, you're not going to be able to afford it. And it's just going to be people who are much well off, are in a better situation, or they have better insurance to afford these drugs. And so, and some of the, poorer countries who don't have as much access and have little funding, will fall short as well. So I don't think enough is being done, to prevent people from being afraid of these things. They feel like it can't happen to them. And that's why more younger people are contracting it. Even things that aren't HIV and AIDS related STDs, they're contracting even more so because there's no fear. And I'm saying this because I've sat with a group of young people who totally didn't even know what this disease was. They had no knowledge of it. We asked them about it. They didn't even know what it was. And so not enough is being done. And that is true. And there's no fear. And, how can you fear something you don't even know what it is? And you don't know the severity of it. And so I remember like when people were first contracting this and then people were dying, there was the fear. And then people were a little bit more, you know, um, taking steps to try to find out what it was. And then there was more of a push for people to bring out the awareness. And then for young people, they were even rappers that were putting it in their music about the importance of using condoms and trying to stay safe. And they were rapping about songs that showed people who actually had went through this and what they wanted for young people to do. There was more of a push for people to try to be more healthier in their choices of activity. And so now you don't really see that anymore because people are living longer and there's no fear. And so this new generation doesn't feel like it can happen to them. They didn't live in that time when people were dropping like flies by the thousands into the millions. And so they don't have that fear. And so if it happens again, unfortunately, some other lives will have to be lost and then it'll start all over again. But the scary part about this is if they don't have any funding, then they won't even have money to even, you know, save any more lives. So that sounds like what this is. But, people are going to look at it and they're going to say, that's not me. That's not happening to me. You know, I don't have to worry about this. I'm safe. And you wouldn't believe some of the things that people think is safe. Some people think if I take a bath, I'm safe. If I don't sit on the toilet, I'm safe. you know, they think things like that is making them safe. If I just sleep with one person, I'm safe. You don't know what that person you're with, you don't know what their activities are. And they're not even aware of who they're with. They just think just because the person looks good and they look clean that everything is safe. You don't know how many people that person has laid with. And so that exposes you to these diseases and these viruses. And so, and whatever else, it doesn't necessarily have to be HIV and AIDS. So you would be surprised. Some of the stuff I've heard the younger people of this generation say that they think it's not going to happen to them. And so this is not a shocker to me at all. And I've come with this before, but it seems like it's gotten worse anytime they're bringing this out again. Thought, feedback, comment on this. Thanks for listening.